Dunedin Hospital. What I do want to do, though, is continue to make sure that we hear answers on this side of the House that the New Zealand public is entitled to as to the financial performance of its health service. So I want to repeat my question, which has not yet been answered, which surely will be released in official documents at some point, so I don't know why it should not be answered this evening. What was the Q4 result in terms of surplus or loss for Health New Zealand? Now, one of approximately 70% of Health New Zealand's costs are staff, and therefore it is hugely concerning that efforts to cut funding at Health New Zealand will touch on our valued staff, particularly well, actually all staff in Health New Zealand are valued, but that side of the House made a particular promise around cuts to frontline services. So returning to our theme of transparency this evening, I do want to ask the Minister, why hasn't there been government comment in terms of net staffing changes at Health New Zealand? Why are we always hearing in response to concerns about nursing staffing that X number of nurses have been hired without saying how many are left? And can he confirm suspicions that have been canvassed in the press multiple times when workers speak out about what they're experiencing, that there is an effort to lower the number of nurses either across the country or in particular services? Because I don't think it serves anyone for this process that is going on at the moment to continue. And just to recount what that is people around the country, frontline health workers, but particularly nurses, are putting up, have had vacancies approved to recruit to, and then they find out that the vacancy is cancelled. We've had instances of them disappearing off the website after they were approved. People are informally told an offer is coming, applicants are told that, and then it doesn't arise. Business cases that were approved are revoked. If we listen to frontline workers, they are telling us their health services being cut, and yet there is no transparency or confirmation of that from the government. I ask you, Minister, to come forward and say the truth about what is going on. Why so quiet after saying there's a $1.4 billion overspend about what you're actually doing to stop it? We've also heard from clinicians that they are finding vital support staff being offered voluntary redundancy, or in some cases being not being replaced if they take maternity leave or they resign for some reason, which of course in a very big organisation happens continuously. We heard a cardiologist making comment the other day about the fact that he is booking his own clinic. Well, what a waste of time for someone who probably earns over $200,000 a year. And also, what about the value we place on the importance of those people who help patients navigate the health system, like our booking clerks? It seems to me that this attack on staffing in Health New Zealand is well underway, and yet we haven't heard any confirmation from the government about what they're actually doing. The people of New Zealand are entitled to know about what is happening in their health system. Their health workers are desperately trying to tell them every day, and yet officials and the Minister just shrug that off, say it's operational, talk about again in the last couple of months, but not actually say what the net change in staffing is. It's time that the government come clean on the issue of their cuts to the health system.
Honourable Pina Hinaro.
Specific to Māori health, in front of the committee, the Minister has said that the money that was used by Te Whaiora has simply transferred over into the health team at Health New Zealand. So therefore my questions are very simple. One, can the Minister confirm the allegations of delay in contract confirmation for Māori health providers across this country, which has two, led to them releasing staff and then furthermore being unable to bring them back in to ensure that they can continue the services that they're being contracted for? And three, finally, Madam Speaker, a very specific one about the statement made during the estimates that the Minister has transferred that money from Te Whaiora over to where it is, the transparency around that money, what's being used for now, and whether or not there are any delays in reaching the front line for Māori health services.
Madam Chair.
Honourable Dr Shane Ritchie.
Thank you, Madam Chair. To answer the first member who spoke, as I've said previously, Q4 report will be released in due course, considering it's only 10 weeks past the end of the quarter. That is a little bit early. Secondly, talking to health workforce, the largest number of nurses ever are currently employed, is what I have been informed. More than 600 nurses were offered jobs in June and July, and I understand a significant number of SMOs as well. To speak to the member and continue to progress some of the Māori health questions, she had a question around immunisation for Māori. Immunisation for Māori still falls variably between 10%, sometimes more, depending on which immunisation you're looking at, for Māori compared to non-Māori, and that is a significant problem. Which is why before Christmas we enabled the $50 million immunisation initiative, which uses the things that whole Māori can do that mainstream cannot. It goes further, reaches into vulnerable communities where mainstream cannot or will not reach. Very pleased with the success of that program to date. The target was to be 10,000 vaccinations, 33,300 have actually been delivered, and a significant number of vaccines also from the smaller contributor, the direct whole Māori providers as well. So that immunisation program is having some benefit. With regard to my colleague around delay in Māori health contracting arrangements, I'm not aware of any, but I will double check that, but I'm not aware of any at this point.
Jenny Marcroft.
So what I'd like to go in with first here is health is one of the areas that I actually, even as a left-sided voter, disagree with Labour on, because they harp on and on and on about the National doing a bad job, but successive governments, including them, have done such a worse job, because they did terrible on the waiting list. They did terrible with the nursing pay. They did terrible with a number of other things. So they can't. I find it difficult when people like Ayesha stand up there and say, "Oh, we can do a better job," when they have 6 years to do it, and as somebody who suffered as a result of the waiting list, especially, it's quite sad. That's what I've got to add on the health thing. It's more of a personal thing, but
Sometimes you need to hear those personal stories. I mean, put it this way: you use the health system a lot more than say I would. Like my last, actual hospital visit that dated in staying overnight was back in 2015.
Yeah.
Was it 2016, which was appendicitis. So that's my last real serious interaction with the health system other than visiting the GP. So whereas I know you've recently been through the health system with hospital, and I know that wasn't exactly pleasant.
Yeah. So it's like for the Ayesha to stand there and say, "Oh, they're not doing a good job with this, that, and the other." Well, they didn't. Well, the health system wasn't any improvement under her watch either. So it's,
Well, she only had 1 year, but I know what you're saying on there. I mean, I do remember I think we had 4 health ministers over that 6-year period because David Clark screwed up.
So all I'm saying is it's a bit rich coming from her. That's all I'm saying.
Everyone else is quiet.
Yeah, I mean, all I got to say is that we're more than grilling our own side on the barbecue.
Now, is that barbecue gas powered?
Does anyone agree or disagree?
You caught me, yeah.
Does anyone agree or disagree?
I just want to say that, look, we all love our nation. We love New Zealand. We care for New Zealand. It's just different approaches, isn't it? Like, I know the right and the left just want to tear each other apart, but actually,
some don't.
And it's just...
I'm not really interested in tearing people apart.
It's just like, okay, right, you need to have business people to start businesses, right? And then you have to have a directors to run the business. You have to have managers, and then you have to have the workers. Not because it's not, like vertical, right? It can be horizontal. And then today the in thing is horizontal management. And the left can take credit for it, maybe. But it's just a management strategy to be more level. And there's always that dichotomy, the perception, these people are going to exploit us from the worker side of view. And there are some grounds of exploitation, but there are some really good social businessmen who actually, have worked hard from having a small spare parts shop and then grew it until it became so big and employed like 10,000 people. And they even let the workers share in it. So there are people who actually have the social...
You described...
I don't know if we want to get into a capitalism versus socialism debate.
A former business neighbour, Alan Chambers. He was one who he handsomely paid his staff. Including, I know one of his staff members was on more than $40 an hour because that's how he felt, because of the work that was brought in and out. That's what he felt was right as part of the reimbursement in the process. Plus, he was also one under the old apprenticeship system before Labor changed it, used to pay all of it out of his own pocket. Out of his own business's pocket, not paying it onto the staff to pay. And he also was given them living wage, not trainee minimum wage, which is 20% lower than minimum wage.
Yeah, my dad was the same when he was working as an optometrist. Man, those receptionists were paid really well.
Wow. And how about those who are given a share in the business? I mean, we hate this person, some of us, from the, like Warren Buffett was a guy who literally gave a share, like literally, like you could have like 10% of.
He gave shares as a part of the remuneration package, which some companies do that in New Zealand, some companies don't.
Yep.
Yeah, and I think the only thing he actually had, although he was a billionaire, was he was, and I read a book about himself and a biography, and he actually just had a stake, which was his raison d'etre for the day. That was his highlight. He would have his steak every day, and he would be making billions. And many people who put money into his investment firm, Berkshire Hathaway, was making millions. Like literally, like after 10 years, that $1 became $1 million. And so this was the kind of good example of how businesses grow and workers.
I don't know how we managed to get on this from a health portfolio, but okay.
But look, this is for better health, because this is for getting people into work, back on track. I know you don't like the word
should we take a look at...
All right, so promote apprenticeships.
Yeah.
Okay, we like that.
Should we